Monday, Baptist Health set a testing record, testing over 1,300 Arkansans and many more in line today to get that test. Joining us live, Dr. Amanda Novak from Baptist Health with the latest on Omicron. Dr. Novak, thank you so much for joining us. I know you are all so busy. Where do we stand in Omicron right now here in the state?
I would, if I had to put a word to it, it would be chaos. It's truly unprecedented what we're seeing right now. And so the hospitalizations are not as bad. These patients are not as sick, but that does not negate really how very disruptive this is. So we are seeing really remarkably high numbers, lots of people getting tested, but then also lots of staff out, lots of ER visits. The system is really pretty close to being overwhelmed. Before it was the ICU that was overwhelmed. Now it's really kind of the front of the hospital that is thumping.
And you and your employees are all doing an amazing job. I know everyone is exhausted, so I appreciate you being on the front lines right now. These lines are very long. Everybody is getting tested. When do you suggest people get a test, and what can people do in advance to make the testing process go more quickly?
Yeah, so I have a couple of suggestions. One, if you've already tested positive this week, you're probably positive, and really coming back to get tested again is sort of just, making those lines even longer. And so I really don't recommend testing for people who have already tested positive in the last few days. So I also don't want to test too early after an exposure. So in general, if you know exactly when your exposure was, then probably 48 hours after that exposure is going to be the earliest that you would want to be tested. But on the other hand, if you have symptoms of COVID, it's time to get tested now. If you have symptoms and it's COVID, that test will probably be positive. And then if you want to make it go smoothly, for one thing, be nice to your healthcare workers. We are working very, very hard to get people through just as quickly as possible. There's a lot of manpower going into this right now, and a lot of late nights and early mornings. The other way for Baptist is if you can go on MyChart, and you can just Google Baptist MyChart, and go ahead and set up your MyChart and make an appointment there. And we have instructions on our website about how to do that. That is a lot of the rate limiting step, is actually making the appointment. So if you can do that before you even get to the hospital, then that will save a lot of time when you get here.
And we're talking about the system possibly being overwhelmed, like you said, with the testing. When do you expect we could hit a peak here in Arkansas? What do you expect the next few weeks to look like?
Yeah, I'm hoping this has to be fast. I mean, this is certainly faster than anything we've seen before, and I expect the drop to be fast as well. What I've been telling people, I can't imagine the peak being after the end of January. I think we will probably peak, I would say, in the next 3 weeks or so. Nobody knows the future, but I think what we saw in South Africa and some other parts that had Omicron earlier is that, it comes in blazing and then it dies down pretty quickly too, in part because it infects such a large proportion of the population that there's just no one left to infect at some point. So I certainly am trying to prep myself for another 3 or 4 weeks of this kind of madness, and then I'm really hopeful that it'll start to die down after that.
Well, thinking of you and everyone there on the front lines. I know it's cold outside right now to be doing this drive-through testing, but we appreciate you all so much, and please send our appreciation and love to everyone there on the front lines.
Thanks.
Dr. Novak, thank you so much. Live from Baptist Health today.